Welcome to VJOncology Podcasts, your source for expert insights in oncology education. Today we're marking Cervical Cancer Awareness Month with a special episode examining the remarkable progress being made in both prevention and treatment of cervical cancer. In this episode, we'll hear from three distinguished experts who are at the forefront of cervical cancer research and clinical care. We'll explore how immunotherapy is revolutionizing treatment for locally advanced disease, why HPV vaccination remains our most powerful preventative tool, and what real-world data tells us about optimizing treatment regimens in the advanced setting. Let's begin. Our first interview features Domenica Lorusso, who discusses one of the most exciting development in locally advanced cervical cancer, the combination of immunotherapy with radiotherapy, and specifically the practice-changing results from the KEYNOTE-A18 trial.
Since more than 25 years, the standard treatment of locally advanced cervical cancer has been represented by concurrent chemoradiation and brachytherapy. Some preclinical and early-stage clinical data suggest that when we combine immunotherapy to radiotherapy, we are able to increase the benefit of radiotherapy. And this is what we explore in KEYNOTE-A18, which is a randomized, placebo-controlled phase 3 trial in which patients with high-risk locally advanced cervical cancer were randomized to receive concurrent chemoradiation and brachytherapy or concurrent chemoradiation in combination with pembrolizumab followed by pembrolizumab maintenance for about 2 years. The trial is a global trial, more than 1,060 patients, and we presented during ESMO 2024 the progression-free survival and overall survival data, which are the two primary endpoints of the trial. In terms of progression-free survival, when we combine immunotherapy to chemoradiation, we reduce by 32% the risk of progression at 3-year follow-up. And when we combine immunotherapy plus chemoradiation, we reduce by 33% the risk of progression in 3 years. And all of this with a very good and manageable toxicity profile and without impacting the quality of life of our patients. So we are strongly convinced this is the new standard of care in this population.
Dr. Lorusso's insights highlight a fundamental shift in how we approach locally advanced cervical cancer. The concept that radiotherapy can induce immunogenic cell death, which is then enhanced by pembrolizumab, represents elegant biological synergy, and the KEYNOTE-A18 data has translated this concept into a new standard of care for stage 3 disease. This approval marks a significant milestone, offering patients improved outcomes through the strategic combination of local and systemic immunomodulation. While treatment advances are crucial, prevention remains the ideal. Our next guest, Amanda Psyrri, emphasizes why HPV vaccination should be a cornerstone of our cancer prevention strategy, not only for cervical cancer, but for a broader spectrum of HPV-associated malignancies.
It's a very important question. So in terms of the HPV-associated oropharyngeal cancer, for prevention, it's very essential to adopt the preventive HPV vaccines. So prevention with the vaccines is very important, and vaccines are not effective only for cervical cancer. They are effective also for HPV-associated oropharyngeal cancer, because in the vast majority of the cases, HPV-associated oropharyngeal cancer is caused by HPV-16 and 18, especially 16, and these HPV subtypes are covered by the vaccine.
Dr. Psyrri makes a compelling case that we often underestimate the full scope of HPV vaccination benefits. While cervical cancer prevention is well established, the vaccine's efficacy against HPV-associated oropharyngeal cancers, particularly those caused by the high-risk subtypes 16 and 18, represents an important public health opportunity. As she notes, prevention through vaccination is not just crucial, it's potentially transformative in reducing the global burden of HPV-associated cancers across multiple anatomical sites. Our final interview takes us from prevention to the treatment of advanced disease. Alberto Farolfi shares valuable real-world data on an important clinical question: what happens when we add bevacizumab to the pembrolizumab chemotherapy backbone in patients with advanced cervical cancer?
presented the ESMO Gane had a real-world study on the efficacy of pembrolizumab in first-line setting of cervical cancer, and we analyzed patients based on their companion treatment. I mean, we wanted to evaluate if there was some differences in the treatment and then the efficacy if the patient received or not bevacizumab. So we divided our cohort of patients in 4 groups based on the companion treatment, cisplatin or carboplatin, with or without bevacizumab. The rationale behind this evaluation was that in the seminal trial that came out with the approval of pembrolizumab, the choice of the platinum was based on the investigator, and also the addition of bevacizumab could be on the investigator choice. So there were not so many data on the real efficacy of the combinations. In our evaluation, we presented before at ASCO the analysis on the type of platinum, demonstrating that there were no differences on the type of platinum used. I mean, if it was carbo or cisplatin, the efficacy was almost the same. But now, with the data presented at ESMO Gane, we saw that the addition of bevacizumab could improve the outcome of the patients. I had to remark the possibility that what we saw could be also related to a selection bias of our patient, because in clinical practice, when we use bevacizumab in addition to our standard regimen, we select patients that maybe could have a more favorable disease. So this could be also a reason why we saw this kind of difference. But another interesting point that I want to underline is that we also try to figure out if the addition of that could enhance some kind of toxicities that could be of very important interest for the physician, and could be also very tough for the patients. And we analyzed the rate of fistula and bowel perforation and pulmonary embolism based on the treatment received. And we saw that the addition of that did not increase the risk of this kind of adverse events, or very serious adverse events. And I had also to say that for example, pulmonary embolism, there was a reduce in the risk of this kind of events. And the explanation behind this observation, for me at least, is that maybe the combination of the drugs achieved a better response to the treatment, so the risk related to the disease to give thrombosis and then embolism was reduced.
Dr. Farolfi's real-world evidence provides crucial insights for clinical decision-making. The improved overall survival seen in patients receiving carboplatin-based regimens plus bevacizumab, without a corresponding increase in severe adverse events, is particularly reassuring. These safety data are critical, as concerns about bevacizumab-related complications have historically influenced treatment selection in cervical cancer. The trends towards benefit in cisplatin-based cohorts also warrant further investigation and may help guide personalized treatment strategies. These insights we've heard today paint a picture of a field in a transformation. As we observe Cervical Cancer Awareness Month, these advances underscore both how far we've come and how much opportunity remains, from ensuring equitable access to HPV vaccinations globally, to optimizing treatment sequences in advanced disease, to understanding which patients benefit most from specific therapeutic combinations. We thank all of the doctors for sharing their expertise, and we thank you for listening to VJOncology podcasts. For more expert interviews and educational content in oncology, visit us at VJOncology.com.